Good morning, everybody, and welcome to the Escape Hatch to Wellness. And our Pillars of Wellness continue with my special guest today, which is Dr. Jen Bitner, who is a functional medicine certified health coach. And she's located in the Chicago area and also bills herself as a naturopathic medical consultant. So welcome, Jen, to the Escape Hatch, and thank you for your time in advance.
Great to be here. Thank you very much for having me. I am not a naturopathic physician. I have to be careful saying that in this unlicensed state of Illinois. I do have a doctorate in naturopathic medicine, so that's why when I work with clients, not patients, they're my clients, and we do naturopathic medical consulting along with that health coaching piece these days.
Well, that's a really great way for us to start, because when it comes time for naturopathic medicine, as you mentioned, it's not licensed in the state of Illinois. So
Right.
when it comes time for naturopathic medicine, how many states can you be licensed in, and how many states are not licensed in that field?
Sure. So there is some kind of licensure or even registration, they call it in some states like Kansas, for 22 states, Washington, D.C., Puerto Rico, and the Virgin Islands.
Okay.
So in 28 states of this country, this evidence-based, safe and effective medicine, holistic medicine, is not an option for people, for citizens of those states.
Well, that's a really good thing then also for us to really accentuate, is that wherever you are, whatever state you are in or whatever country, is whenever you are talking to someone in regards to your health and wellness and your healing, make sure you do your due diligence to make sure that, these people who are advertising specific services, they really are certified, licensed to actually practice in that state. Because for example, I know in Florida, where I'm based, is that I as a health coach I cannot assign food plans. That has to come through someone's doctor, because to do that here you have to be a nutritionist or a dietitian. So as a health coach, I can help somebody follow their health plan or their diet plan as assigned by a nutritionist, a dietitian, or the physician, but I can't overstep that boundary. So it's really important for anyone who's watching this to really pay attention to what is legal in their state.
And there is a distinct difference, and this is what licensure would actually protect people from. There are people that spent $6,000 or $7,000 back when I was going to school. It could have been the same time even. They went through a course like from Concord or Trinity, something online, spent that kind of money, and they can now call themselves naturopathic doctors. They can put the same initials after their name as mine. So to protect people a little bit, I know it's very scary. My degree, it's not just what it costs, but it's what it's worth and what I learned. It costs the same as any 4-year medical degree. Only, unfortunately, I can't practice in all 50 states, which has been very discouraging. And that's a lot of the reason for the health coaching certification as well. So I can use that education. But the initials after my name could be the same as the one that never, went for a year-long course, never got in front of a patient, never went to cadaver lab, didn't have any physiologies of all the systems, didn't actually see patients in a clinical setting, put hands on, do any of that. So there's an accreditation group, the Council of Naturopathic Medical Education, CNME. The college I graduated from, the university, was and is CNME accredited in Illinois, in Lombard, Illinois, but it's the only one in an unlicensed state. So the others the oldest is national in Portland, Oregon. There's Bastyr, a lot of people have heard of in Seattle, SCNM in Arizona, and 2 in Canada. There used to be one in Connecticut, but they closed the naturopathic part down. So at any rate, it is important to see where your naturopathic doctor was educated.
And also, same for the functional medicine certified health coach, because I had not too long ago about, well, you're a coach, but what does that really mean? And I had the pleasure of explaining that even when I became a life coach back in 2008, my course was a 6-month-long course. And there are programs, and I'm not trying to diss anybody out there, but there are programs. You can go to a 3-day check-in Friday, check-out Sunday, and leave with a piece of paper that said, I'm now a coach. And that isn't, so if you're going to deal with someone's life and helping them heal mentally, emotionally, psychologically, as helping them physically heal from the inside out, wouldn't you want to go to somebody who kind of knows what they're doing, at least was trained by people extensively? And I know with functional medicine, we spent an entire year together being trained by doctors, nutritionists, dietitians. I mean, the list goes on and on. So double check the credentials. Important.
Yeah, and it is tricky. So also, if you like what you hear when I tell you about naturopathic medicine, there's groups in many states, Florida included. There's advocacy groups and lobbyists, and it's in various, the bills are in various stages of being closer to being approved. When that comes up on a ballot and you like what you hear and you want safe, effective, evidence-based medicine that's holistic, that looks at root cause of disease, that may be more accessible to you, and you see that come up, vote for licensure, because that will automatically separate us. You'll be able to, because you can only, so I am licensable in the right state because I passed my board exams, and that's what we all have to do, take basic science board exams and clinical science, 2 sets of clinical science exams. So that would be something to keep in mind.
Awesome. Well, let's go back to the naturopathic training that you've been through, and what exactly is a naturopathic healer. I'll use that word instead of saying physician or doctor. But when it comes time for naturopathic versus homeopathic versus integrative versus functional medicine versus aromatherapy, I mean, the list goes on and on.
Sure.
Can you find the difference between naturopathic medicine versus the others?
I can. So naturopathic medicine, so as I said, naturopathic doctors that graduate from a CNME accredited school go through the first 2 years are very, very similar. They're basic sciences to any medical doctor, any MD, DO. It's the same 2 years. I spent 1.5 years in a cadaver lab, learning all the ologies, lab diagnosis, clinical diagnosis, all those things. And then we do, after 2 years, we take basic science board exams. It's very similar to what any doctor would take. And then as we go further in our clinical experience, we branch off from even our, so I went to a school that also educates chiropractors. And they take some of the basic nutrition classes, which is more than an MD even takes, and some botanical medicine. They may get one course in homeopathy, possibly. Homeopathy is modality that we use. It is a system of medicine, but there's very few that practice just as homeopathic physicians anymore, although I know a very, very, very talented one. A few, actually. But at any rate, we branch off into much more nutrition, first of all. So the nutritional biochemistry part is really intriguing to me, and there's a lot of that in combination with, or in agreement with functional medicine. Functional medicine does a lot with, we're in common, I think, functional medicine, naturopathic medicine, integrative medicine. We're trying to get to the root cause of, in naturopathic medicine and functional medicine, what we call disease, as in imbalance.
As in dis-ease.
Dis-ease or imbalance. So as a whole, integrative medicine, naturopathic medicine, functional medicine, we're trying to get to the root cause of what's causing that imbalance. Functional medicine often looks at They now are looking a lot at lifestyle choices, which I'll talk about with naturopathic medicine too. We just call it a little bit something, sometimes a little bit different, but it's the same idea. And they like the nutritional biochemistry part of it, like really getting down to that. And I did too. I like a lot of that from my left side scientist brain likes that part. But we all, so in naturopathic medicine, as also with functional medicine, we look at the whole person. I think where we, and the individual, so whole as in the mental health components, the emotional health, the spiritual health, the physical health being completely intertwined, inseparable, like the whole web of connectivity, like you cannot pull one strand without pulling the whole thing.
Yep.
So imbalance is, we have to look at that as how it's affecting the whole picture. And when we're getting to root cause, it's not just about enzymes and nutrients and all of that. It's this whole picture. And it has to be looked at as each person is an individual, because each one is going to express their imbalances in a different way.
Absolutely.
So one of the things that's kind of I think it's sort of unique, at least in the description of it. It's also the empowering part, I think, of naturopathic medicine, especially in conjunction with someone to guide you through, is that we believe in something, or it is a fundamental principle in naturopathic medicine called the vis medicatrix naturae, or we just call it the vis, V-I-S.
Okay. Mm-hmm.
Yeah, we just call it the vis for short. It's Greek/Latin, I think, but it means, the definition in our minds, and you'll see different definitions, but it's the body's innate, dynamic ability to heal itself. It's the ability, the desire of the body, an innate dynamic. It doesn't just statically do this. It's dynamically, constantly trying to bring itself into balance.
Yes.
And when it shoots off a symptom, let's say you've got inflammation in your elbow, right? It's saying something's happening here, right? And something's out of balance. It could be acute, but if it's going on chronically and we're taking ibuprofen and we're suppressing that signal and we're not doing anything to change whatever's causing that pain, it suppresses it further and further inwards. And so it starts, our bodies start trying to do something else to get our attention. And then what if we put a corticosteroid shot in there? Right? Then we've suppressed everything, including our immune system now. So your body's going to keep, and it kind of goes in deeper. So one of the first signs that something is going wrong often that we learn is skin stuff, psoriasis or eczema.
Mm-hmm.
And usually if we can go in and find out what's causing that and treat it, and treat I have to be careful with, but treat the imbalance, let's say.
Address the imbalance. We'll use address. How about that?
Let's address the imbalance, right? And hopefully bring it back into balance. And it's not even me doing it. I'm going to help you do it, right? So I empower you. And what we talk about, instead of lifestyle stuff sometimes, what we use is we're removing the obstacles to cure. We're taking away the stuff that's blocking that innate ability to heal itself. And we do that by, there's another thing is pretty specific to naturopathic medicine, and that's called therapeutic order. And it's like therapeutic order. You can think of it like a pyramid.
Mm-hmm.
And along the bottom, like on our functional medicine matrix or our timeline, you know how you have the lifestyle stuff like all around it?
Uh-huh.
Right at the like you have your systems in the middle, your digestion, your assimilation, your detoxification, all that stuff, your mental, spirit, and then we have at the bottom the lifestyle stuff.
That I call the 5 pillars of wellness. You got stress, you have relationship, nutrition.
Isn't that the name of the thing that we're doing? Exactly. And so this is how this all brings in, actually, because in our pyramid, along the bottom, the widest part are the 5 pillars of wellness, as you put it, and is very true. Those are the pillars. It's a base of our pyramid. Up at the very, very top, and what we want to do is we hope to be able to go in at that base. We'd love to be able to start there. And we'd ideally love to be able to address all the imbalances right from there, because it's the least invasive, right? But as we move up, like the next part is more supplementation.
You say supplementation, you mean like herbs and vitamins and?
But we have botanical medicine, actually, I think is almost like below in our mind, because it's a whole like a whole food medicine or a whole plant medicine. When we start, and then we start with supplements, a lot of times they'll take one thing out. The same with pharmaceuticals, but in a more chemical way. And this too, they'll take the magnesium out and separate it. They'll take the calcium out. So that's why I like food as medicine so much, because food medicine and botanical medicine, or making a tea and using the leaves and the stems and the, if those all have the medicinal properties, it's a synergy that we need from each component. So as we move up therapeutic order, we actually, it seems like, and I'm just kind of thinking this out with you, but we get more of just the individual stuff pulled out and not the whole synergistic effect, right? So at the very top,
refining process, is that what you're saying? Like it's refined the higher it goes in the order?
Well, yeah, and more, I guess refined is a good way to put it. And sometimes we need that. We may need to address a very specific thing that is an obstacle to the body's innate ability to heal itself. Like something's gone too far. Right. I experienced this personally. I trained as a naturopathic physician. And this was a very difficult decision for me to make. But at the very top of that pyramid is things like pharmaceuticals and surgery, right? And integrative medicine is saying these things are important and we have to bring them in, but then how do we help someone through that? So can I share with you a little bit of my journey?
Oh, yeah.
Because this was really hard. And I think other people are in this boat. And I can kind of say how I was able to bring it all back in, but I have for a long time, I have had an underlying condition where the root cause was never actually determined. I think the loneliness epidemic is a big part of this, honestly. I think, and it's something at some point I definitely want to talk about, because it is a huge predicator for chronic disease mortality. You wouldn't believe what I tell you. I will go back to it. How social stress, how much of a predictor of chronic disease mortality it is. But at any rate, I got it just, in my individual health, I could not lose weight. I was way overweight, obese. And I was having a lot of trouble. One of my main things, certainly arthritis, pain, all the itises. The most important one was esophagitis. So in my throat, my voice was hoarse, and I started having difficulty swallowing as far back as 2012, 2013. I noticed food would get stuck. And so I tried to address this naturopathically. I tried to reduce but I wasn't reducing inflammation holistically necessarily. And I didn't have a coach back then. And I was kind of winging it. And I had a lot of root cause issues happening, and I couldn't do it that way. And I had a very difficult time losing weight on my own, like so many of us do. I tried everything. And then, and I didn't understand how change in us works. So at any rate, I finally had to see, get the endoscopies done, to take a look, and they had to, put the balloon in there and expand my esophagus so I could swallow. The doctors that do those things want you on medicine if they're going to continue to do them.
Yep.
So I went on a Prilosec type thing because they felt that it was all related to reflux, even though I didn't test that I had reflux. But I probably did it. I'm sure I did through my lifestyle of craziness before I discovered any of this medicine, and after. There was still, I was still having issues, and at any rate, they put me. I started taking Prilosec, which caused all these other problems.
Here we go.
Where were we?
And we're back. This is thank goodness for modern technology and Florida and our power surges is what happened. So we were in your story. You were sharing about where you were with being overweight and trying different things to try and lose weight, and then going at it from different angles, and then finally deciding that you needed
surgery.
Yes.
Was needed. Yeah. So to do the surgery, for insurance purposes, at least, they recommend 6 months of nutritional counseling, and you see a psychiatrist who determines that you are. At any rate, for the first 4 months of that 6 months of nutritional consulting, I was trying to see, if I could lose weight some other way. It had to come off drastically and quickly, but at any rate, by the time I determined that I needed to do this, I needed to do it this way. It was about, my surgery was in July, or potentially in July, and by about May, I connected with a health coach. In March, I had decided I wanted to be one, and that this would be a really interesting program. And I thought, this is an amazing thing, because, with my education, I have all this information, right? I know what to do. But I couldn't get to the end result. And when I read about what functional medicine coaches can do, and they can bridge that gap, they can form that road, help you get on that path, I was very intrigued. So the health coach really helped me prepare and to get in the right frame of mind a little bit, because I was so torn. My nutritionist was very good too. And she said that she'd support me no matter what I decided. I didn't have to go through the surgery. I never felt like I had to.
I have 2 questions for you before you
Sure.
go any further. So you were going in for bariatric surgery, is that correct?
That is correct.
Okay.
Yes, and the reason for that, not just for the weight loss, which should have actually ended up helping with a lot of other things like sleep apnea, and certainly the swallowing should get better, and energy and all those things. I'm still working on a lot of those factors. Surgery did not correct that. I did lose a lot of weight, no doubt about it. Wrinkles now I didn't used to have, but my neck was like out of here, so it's no wonder, right? And all that pressure could not have helped. So that part was beneficial. What was the other part of the question? Wait, I forget what you were asking.
I just first asked if that was bariatric surgery that you were going.
Oh, yeah. So the reason was because they still were saying that it's reflux, which I'm still not convinced necessarily of that. But the surgery that I had reroutes everything. So now I have to focus very much on getting nutrients in, because I was getting, from the medication, I feel like I was getting reflux of bile from my liver and gallbladder in all the way into my small intestine, into my stomach. Like significant amounts. My family history predisposes me to duodenal, which is a small intestine, and stomach cancer. My grandfather died of that. So I didn't want that sitting around in there. So what we've done is prevented the bile from ever coming into my stomach. That's not going to happen. That's disconnected. But that area of the small intestine is also really important for nutrient absorption. So I work with coaches and other functional medicine practitioners now in really getting as much nutrient density in foods and even protein shakes and so forth as I can, like maximizing that.
So with the nutritionist that you were working with prior to your surgery, was that nutritionist a traditional, like a traditionally trained nutritionist, or was that person a functional medicine nutritionist?
She was very much a traditionally trained nutritionist.
Okay.
So she is a wonderful person. She's actually shouldn't have even been doing the nutrition stuff because she's done it for 30 years. She's now the dietary manager, like in charge of the entire hospital's
Yeah.
dietetics.
Yep.
And then doing doing this too. I mean, she was always running around, and she had the skirt, the suit and heels, and you're running around trying to meet with me. She's a wonderful person, very holistically supportive. But I had to come up with my own way of getting nutrient density and that sort of thing.
The reason why I asked was because, I know that anyone who's a functional medicine certified practitioner of nutrition or dietitian, they have to be originally traditionally medically trained, and then go expand outward, into, going to the root cause instead of just, here's the Band-Aid. I was just curious if, when you were comparing what her health or nutritional advice was versus some of the nutritionists in functional medicine that we were trained by, what was the difference between the two did you hear?
So, at least for bariatric surgery, they are very focused on protein, and more protein. So they want you to, they didn't focus on once I was out of surgery, how I was going to get nutrients in. They wanted to make sure that I drank a lot of water, very important, and got protein in first. And I understand that. And recovering from surgery, that's important too. But all white. I mean,
White.
Chicken, cottage cheese, you get everything pureed. But that was the big part of that's all they wanted you to eat in the beginning after you were off the protein drinks, which, mine had a whole multivitamin in it in all the most bioavailable forms of all the nutrients, at least, but most people don't get that. So I do want to work with people, even if they do go to this. I'm like, where do I get my vegetables? Where do I get the colors?
Where's the rainbow? Where's the rainbow?
Where's the rainbow? I can't eat like this. I mean, how am I going to get up off my chair when I don't have any nutrients in me and do the rest of this? And frankly, our mental health is intricately linked with our gut,
yep.
Right?
Mm-hmm.
And so, how people get through this, I don't know, without nutrients most of the time. But it was it was a book that was probably put out in the 70s. I don't know how much they've updated, like the workbook you get. Mm-hmm. But I would do green juices.
Oh, good.
That I made. With one apple and the whole thing, and a ton of cucumbers and a ton of kale and spinach and lime and, the mean green juice, basically, with an apple to sweeten it, but I still think it's good. Ginger, and that's what I still do that to get those greens in.
It's something that's the reason why I asked you about your experience, with that particular nutritionist versus the ones that we were trained with in functional medicine was, so my husband and I both have been very much involved in Ayurveda. And we had an Ayurvedic physician who was also an MD. So he's more like an integrative physician because he uses Ayurveda and traditional medicine together, plus yoga. So all that kind of fits under one umbrella. So we had learned a tremendous amount of, how to eat, time of day to eat, whatnot. And all of this, very immersed in this culture. So my husband was selling a brand of cooking pans called Kitchen Craft. And they're made, I think, in Wisconsin, and 100% made in America, and they are stainless steel pans. And he had an opportunity to go to a hospital to go and do a cooking demonstration for the bariatric patients who they had come out of the surgery, and they were now learning how to maintain their lifestyle with their surgery. So we show up together. Now, both of us are like complete foodies, both, very food aware since we were children, and, all excited about sharing this knowledge that we had about food and nutrition and, the nutrients you get and how important it is, and not just what you cook, but what you cook it in, because
sure,
that can affect the nutrition as well. And so we show up, and the nutritionists are giving a lecture, and then they're going to introduce us and segue into the demonstration. And all they really were focused on, and I apologize to anyone who out here is listening to this, but they were focused on reading the labels on the cans to check for the calorie content, the fat content, and the sodium content. That didn't talk about, nothing was to be raw or fresh. It was all prepackaged, frozen,
Right.
or canned. And the two of us had to work very hard to not go, oh, all right, how are we going to recover from this? You know, you people don't need our hands.
You need some dang nutrients. You need a garden, is what you need.
Oh my gosh, it was so funny. And
it was a real learning experience.
Yeah, I'm sure.
And it was tough because my whole background, you know, and before naturopathic medicine even, was let's do this naturally.
Mm-hmm.
To have that intervention was tough, but it's where you can start to integrate, though.
Mm-hmm.
I feel like it could be an opportunity.
Yep. Oh, absolutely. And you know, the one thing that you said, I think was a really key, was that you had the knowledge, you had that knowledge, but you just couldn't do it. You couldn't do what you knew.
I didn't know how.
You didn't know how.
And I had failed so many times. And before I took our functional medicine health coaching course, and before listening to Dr. Sandra Scheinbaum, who founded the FMCA, talk about failure and how that is an opportunity, I didn't think of failure that way. And I still actually have issues, imposter syndrome and doubts and, you know, all that kind of stuff. But then I had failed so many times on my own.
Mm-hmm.
I just didn't know what to do anymore.
Yeah, because you're not the only one. It's so common. And when someone says, well, you know, I know what to do, I don't need a coach. But, you know, as you saw, and yours is not, I wouldn't say it's not extreme. I don't want to take away from what you experienced, but at the same time, I mean, whether it's something that, you know, a small goal versus a major one like you had to, it still is having the value of someone who's there to cheer you on and kind of like put the guideposts on so that you stay in your lane and you accomplish. I mean, when we know what to do, but there's just something that lies within that is that hook that keeps us from doing it. Because sometimes I think our minds don't want us to be healthy. They want us to, you know, be free, or there's just so much self-induced pressure that keeps us held hostage, you know?
And do we really think, I mean, in my case, I finally had the surgery because it came down to the fact that my why was I would really like to not embarrass myself every time I'm around good friends and we have dinner together and I have to separate myself and yeah, whatever. It was gross, but right, trying to get this food up. But so it became my why, I guess, you know, for having the surgery, for losing the weight. Was really that, but it's so much more than that. Mm-hmm. What this means to me and what having to go back down to the bottom of the pyramid now, mm-hmm. because I was up there, I had the surgery, but that I can't stay up there. I can't keep taking pharmaceuticals and having surgeries. I've got to come back down and get healthy holistically. So I spend that time, you know, at the bottom of the pyramid, or the big base of the pyramid, the 5 pillars. But at the same time, I can't do that myself either.
What's that?
I can't do that myself either, though. You know, I still need that. Mm-hmm. I still need a coach in my life. Multiple for different things to help me bridge and determine what my why is, mm-hmm. and help me bridge from in here. And all the books like behind me that say all the stuff to do. Mm-hmm. And getting to that intrinsic motivation, that stuff in here, the reason why.
Yep.
So naturopathic doctors have a lot to offer people, though, of ways to do that. And this is here's where it kind of, I don't know in how many systems of medicine this is important, but I know it's becoming more important now. Not only can I help someone and empower them to be, you know, help them become empowered, mm-hmm. but anyone can do that. I gave a graduation speech for the FMCA, but when I graduated naturopathic school, I was honored enough to be able to do that. And I talked about this even then, and I graduated a decade ago. It's more important now than it was a decade ago to me as an individual and to our worldwide community, is to take it out. You and I can talk to your community here, but we can take it past, and each of them can then empower their own peers, their family, their friends, their in whatever communities that we're in. And that, according to James MASKELL of the Functional Forum and others, is the basis of the evolution of medicine. And Community Cure is the name of the book that talks about this more. It's really crucial, and naturopathic medicine is a vehicle for that. I mean, when you get really into it, and in those 22 states, naturopathic physicians, they're naturopathic physicians often, they are called that in those states, they're primary care physicians. So the tricky part, though, is that they need to spend a lot more time to be holistic healers with someone, right? It takes longer. They need the coaches too. So in these states where they're primary care physicians, they can come up with the food plan, but they can't spend, and I couldn't spend a lot of time individualizing that plan. I would come up with the wellness plan, and I would address each of the pillars and going up the pyramid, even if supplements were necessary, botanical medicine suggestions, that kind of thing. And I would write out the plan as individualized as I could, but we didn't really talk about what the potential obstacles for people would be. We would hand it to them. And now I'm kind of switching back and forth, I know, but we would hand it to them, and they would, check back in with us in 30 days was typical. And often not a lot had changed because they didn't know what to do with it.
Yeah, they didn't really have anybody to hold them accountable to do check-ins. They just took what you gave them and said, okay, well, I can do this, but no one to go through their cupboards with them, or no one to go to their house and take a look at, what they're currently using, and looking in the refrigerator and kind of restyling their habits. Yeah.
And how often do you think they came back to me in 30 days and went, whew, I feel much better, let's do this again? I want an elimination diet, the gold standard for determining what I'm allergic to. That went great. I mean, no one, I couldn't do it on my own. I mean, it's really, what is it, 95% of people do the figure 8 thing, not the straight line down the change path.
Yeah, most people don't want to be uncomfortable. They don't want to change their habits, or they do want to change, but their family, their friends want them to remain the same, because, if you look at people in our community as a tribe, so we become immersed in a tribe, and yet if we go to learn something new and try and bring something new back to the tribe, as long as the group accepts it, then that new habit can become a new habit. But if that habit, that new introduction, is so alien to them, they'll just, say, go away, or, they'll excommunicate you, or you won't be part of the tribe anymore. You got to go find a new tribe. And that's a big thing, is when you lose your tribe.
That's a very big thing. And again, that's community medicine and peer medicine. We need our tribes. We need our tribes more than ever. And so I I could see where we could help people, and that tribe formation, that, can be done in any setting. I mean, you can take an already created community. It can be a church group, or your community, your captain's table community, all of us have, especially those of us that went into, like, for instance, functional medicine, health coaching, or naturopathic medicine, or whatever we went into, all of us as a second, third, in my case, 8th career, so we have all the people that we had met along the way that became part of our community.
Yeah, they still follow us. Yeah, they will. I mean, because and I really believe that in some way, shape, or form, that in your case, 8 careers later, and I'm not sure how many more I've had. I would say I've had more than 8 because I've had like 2, 3 basically, because I had my cruise ship, I had my travel industry career, and now but wellness. But it's interesting. I had a conversation with someone recently who said, how can you go from like the travel industry to wellness industry? Like those two are so foreign to each other. And I said to him, if it is from the outside in, it may look rather odd, try and build that bridge between the two to connect the dots. But wellness has become a big part of the travel industry over the years. I mean, the cruise industry with menus, with spa services, with tours that would enhance a wellness experience when you get to a foreign port. They have all of that. Like I said, the dietary options that are on board that didn't used to be on board.
Right.
So, and now of course with COVID and having to address wellness from that level too. But, as a crew member, I had to stay healthy. If I didn't stay healthy, when I came in contact with thousands and thousands and thousands of people every week, I would have been sick constantly. But I worked on board for 15 years, 20 in total in the industry. I still cruised in the last 5, and I still stayed healthy. And when GI issues would come on board, that's the Norwalk disease or Norwalk virus, whatever, I had my staff who would get it, who would just go down for days. I had even one staff member who had it twice, and she was my assistant. And in all the years, I never got it once. Do you know what the odds are to have never gotten GI on a ship? It's slim to none.
It would be astronomical.
It is. And with all the passengers, all the crew that I came in contact with, I never got it. And why? Because I was so aware with what I touched, what I ate, even how I ate, all of that. I was so self-aware. I mean, this is really kind of a funny thing, but I had it's called Tradition of Excellence. So in between shows, I would go to the bar and have a glass of wine. And our bar staff always served little jars of nuts, on the side with your cocktails. Mm. And in the beginning, they would put the jar on the bar, next to my glass of wine, and I wouldn't even touch it. I would say, no, I don't want them. So after somebody finally asked me why I didn't want the nuts, and I said, it's not that I don't want the nuts, but have you ever watched the people in this lounge with those nut containers? They're sticking their fingers in there and they're, licking their fingers and putting them back in the jar. And if there's a fingerprint on this container, I do not eat it. So
nobody cared though. I think that's how I built my immunity up.
I know, but
you're on a cruise, you're drinking. I mean, you were sober. We didn't care. But I think my immune system got really built up from that.
You should have cared. But it's
I know.
All those things, and I was but it got to the point where the bartenders would see me come in, and they would bring me they would go to the back, they get a fresh glass jar, and put fresh nuts just for me. Right. I had, but like I said, I stayed healthy, and I got bronchitis. I think in 15 years, I got bronchitis once. I never had stomach flu. Sorry, I had bronchitis twice. The second time I got it was so bad that they put me on a nebulizer, and that was the end of my shipboard career. I knew I could not continue because they were using this combination of bleach and hydrogen peroxide to clean the railings to clean all the germs. And with that stuff in your lungs, I mean, the horrible respiratory issues, and doing that, the respiratory issues with the crew go up, and I was like, I couldn't breathe, and I was like, that scared me. So I said, you know what, I'm done failing. So, anyways, long story.
Well, and it's all really important though. So you were brought up this way, from what I remember. I mean, your mom was very much in the wellness arena and brought you to your own chagrin. I think sometimes in the early days of, oh my God, wow, really? But that's how you were kind of raised, right? I'm not doing the interview, I know.
Oh, no,
but at any rate, But for so many people, they don't get.
Like, I didn't live in a commune. My mom was not a hippie at all. My mom was a businesswoman who we didn't know, we had a microwave, but I was never allowed to use a microwave in the house. Never. And I still don't use it. Never.
So a lot of people weren't necessarily brought up that way, but it's very pertinent now. This community health, even more so, access to health, but to do the best we can right now to build that innate ability to heal, to support it is really what it is. It's supporting the vis so that when things come at us that we've never seen before, because no matter how many messy peanut jars I ate out of or disgusting things I did to improve my immune system, it's never seen COVID-19. Yeah. Right? But it's going to give me some warnings. Mm-hmm. And it's going to give you warnings. And what I want to make sure is that everybody else sees the warnings for what they are. Like exhaustion, for one thing. You know, that's, if we're really tired, then, you know, we're more susceptible to getting sick, right? If we're really stressed. And here's the whole tie-in to this loneliness thing. If we're under social stress, if we're lonely. Did you read about this study? I have to tell people about this. It's in this book, but it's the Community Cure by James MASKELL.
Transforming outcomes, is that what the
Yes, transforming. And the Mark Hyman is in here, but I think your guy isn't Dr. Perlmutter your guy? Oh no, he writes the entrance for Dr. Bredeson's. Dr. Mark Hyman writes the preface in here, I think, and he's also spoken a lot about, because of his Daniel Amen, the experiment they did with group visits. But at any rate, what I wanted to talk about though is this study that's it's in this book, or it talks about a number of studies that you may have heard about, how much more a risk high social stress, loneliness is to chronic disease mortality. So that means like mortality from heart disease, stroke, heart attack, diabetes. I would like to say mental health is a big part of chronic disease, addiction, right? And in this, they defined in a UCLA laboratory for stress assessment and research, they are studying, there's an emerging science called the human social genomics. And they did some research, and also there was a 2010 study, and all the way back to a 1988 study that was published in Science magazine about this. And they rated, so let me give the example. So physical inactivity has a 1.23 risk for chronic disease-related mortality. Get this one. Alcohol greater than 6 drinks a day.
Six drinks a day of alcohol. Do you know how?
1.31 is the risk factor. I know this is this is a study, recent study. Smoking. So we're at 1.25 for physical inactivity, greater than 6 drinks a day, which I cannot imagine, but that is drinks at probably measured at an ounce of alcohol. So that might be 3 for some of the rest of us. I don't know. Risk factors, yes. Okay, but 1.31. And a lot of people who are lonely drink more.
Yeah.
Right? So it just kind of goes back, or are depressed and don't want to do physical inactivity, right? Smoking greater than 15 cigarettes a day, which they put as a higher risk than even drinking 6 drinks a day, 1.52. High social stress, which can be loneliness, it can be breaking a social bond, like a divorce, getting fired from your job, losing your job because you're losing a whole community. How often is that happening right now? A lot. 1.65. Greater risk for chronic disease mortality than smoking more than 15 cigarettes a day, drinking more than 6 drinks a day, being physically inactive. It's huge.
It is. Wow.
And I'll tell you, that's kind of the reason I realized, I think a lot of my life, that's for me personally, that was a big part of it. But now I'm seeing all these people that are coming to me, and boy, is it common. Yeah. Now more than ever. I mean, it's been a factor for me for 50 years, but for so many, and for so many, I think it has been too. But it's more and more. So people are coming to me to coach through some lifestyle issue, and I would say nearly everyone is reporting some amount of disconnection. Mm-hmm. We know spiritual health isn't just about going to church, if that's what you choose to do, or yoga even, although I know it helps, or mindfulness. It's connectiveness. Mm-hmm. And so that's the next. As a naturopathic doctor, I can look at a lot of patterns, and I can put the systems together, and I can definitely analyze if there's nutritional deficiencies and what they are. And I can look at genetic reports and analyze those. And what I'm saying though is that all of it's great, but we still have to, and that'll educate people, but we still have to be able to get them from education to intrinsic motivation.
Mm-hmm. Yeah, to change the knowledge into experience, or even to educate, to understand, to comprehend, and then to integrate into the body, so it becomes almost a muscle memory, and it's an automatic response, like your heartbeat or that you breathe.
Transformation, yeah. Right? And so we can do that individually, but what this book proposes, what a lot of things I've read propose, is that we do this in groups, that the evolution of medicine is group medicine, or what I really like, peer medicine.
I like that.
And we take it out amongst our peers like we're doing here, mm-hmm. and join together. And then those peers talk about, I love the word synergy. Mm-hmm. 1 + 1 = 3. Yeah. So I like whole food, whole plant, whole everything is synergistic. Mm-hmm. So everybody healing each other, like it's someone will come up with a viewpoint, a perspective, so that's their own, but someone else can relate to, and they take that out, and it could be a beautiful thing, and it solves loneliness and purpose.
It makes me feel like I wouldn't say healing through osmosis, but healing from proximity, healing through the connection, like just being with someone. So like when you're friends with someone, or you're helping to support them emotionally, physically, psychologically, I mean, all these different avenues, and you're in a communal environment, it's almost as if the cells have a way of regenerating themselves with a level of immune fighting for that specific dis-ease. Do you know what I mean?
Yeah, I love it. Yeah, absolutely. And you can feel the energy even when we're talking about it. Do you feel different? What I'm kind of saying is, even when, because we don't do a lot in person anymore, there's definitely the oxytocin factor, right? That hormone of love and
happy hormone.
Yeah, the happy hormone, right? The reason my dog is helping me these days so much is just, we share a lot of oxytocin. He's about the only one ever home with me. But you can do that. I feel like energetically, I think about how much our cohort, when we were going to school, bonded together. Mm-hmm. We, weren't in the same room, but the energy that we got from each other and from our course facilitator was amazing. And so I think there's a lot of room to heal in this way now. Mm-hmm. And I cannot think of a time that we could use it more.
Yeah.
Than this time of this isolation. So, I just want to carry the message as much as possible, because I feel like it's really important that we need to connect with each other.
Yeah.
We need to try to find a way. this is going to be going on for a long time.
Mm-hmm.
This is going to be like this, despite what some might say. I believe in science.
Mm-hmm.
And I know that this is going to be going on well into next year. And already I had a week of, oh my God, I don't think I can do this anymore. But it doesn't matter. It's sort of like, it's going along, and a lot of things happened to me this year, and a lot of stuff has happened to a lot of us. Life does go on, or doesn't go on, or whatever, that it happens anyways. But I feel like it's starting to add up for people a little bit, maybe. It's like we can get through a couple months of this, of the hardest times, but I'm afraid that some of the challenges are just starting with this.
Yeah, and looking at the 5 pillars of wellness, and we've got, as stress, we've got sleep, we've got nutrition, we've got fitness, and then we have relationships. And I know for myself, as my own personal, not a preference, but it's my own practice, is to help people with the relationships that they have with themselves. Because if we have a dysfunctional relationship with ourselves, we're going to have a dysfunctional relationship with other people. It's going to show up, whether it's in our immediate families, with our children, with our parents, with our grandparents, with our spouses, even with our coworkers. It's going to show up there. But with being isolated, and if you are in a relationship with someone who was better as an external relationship, this could even just be a friendship. It's just, you were social friends who met at the bar once a week and whatnot. I don't know if those kinds of friendships will be the ones who actually survive all of this social distancing or connecting via the ethers.
Right.
Because we need that. We need it's almost like a heart-based connection. It's like a resonance that comes. And I know with like HeartMath, they study that we actually receive life and experience life first through our hearts, and then our hearts send the messages to our brains, and then that's how. It's not that we get life through here and then send it to the heart. It comes here and then goes up, and then it's broken down and interpreted by the brain and the mind. And this situation that we're in with COVID is kind of shoots that home, that you can still have that resonance come through Zoom or Skype or through the phone.
Right.
But that resonance wasn't there to begin with. That relationship's not going to survive any of this.
Oh, true. I think that's true. And I'm thinking more for people that are at home and don't think that they can connect with their groups. I know of someone that I only knew as basically my partner's friend or mentor, and she has a health condition that makes it very difficult for her to see people anyways. But very extrovert did. And I saw, after we spoke, I saw where she started posting things about where, like, her group is this church kind of community-based group, a women's group. They're all really intelligent, strong women, compassionate, empathetic, wanting to help people. Most of them are retired, I think, not all, certainly. And they're all leaders, but she is their leader. She's the leader of this group. And I was watching after we spoke, she put some stuff on Facebook about which groups in her area needed donations the most. And I thought, and this was someone who kind of expressed that they didn't feel connected, they were lonely, and just was kind of thinking maybe this is it. Mm-hmm. And then just gradually starting to rediscover that purpose, that sense of purpose and connection with those people. And she has a heart connection with those people. They may just be acquaintances. I don't think my partner and her have seen each other pretty much since me. I met her maybe 6 years ago. Mm-hmm. But they have that heart connection still.
Nice.
Right? So I'm kind of thinking, I think that's where this came from a little bit. And for me too, I know how what you're saying hits home. Mm-hmm. Very much so, that we do have, absolutely part of my problem is I don't have that relationship with myself. And I know I do need to in order to take that out, because I want to take out, this wholehearted, wounded, but, still strong, experienced, certainly experienced.
Awesome.
And put that person forth.
Mm-hmm. Well, that person's already in there, just covered up with, other stuff that kind of got in the way. And we all have that. Every single one of us. And these times I think are especially challenging because of it. But, the blessing is that with functional medicine and with naturopathic medicine, we know that there are solutions, and we understand the concept of going to the root cause, of going beyond the emotion to what was the trigger for it, and going inward, as well. But I would like to ask you, when it comes time for naturopathic medicine and the 5 pillars, how would you look at naturopathic medicine with each one of them? Let's start with sleep. If you had someone who came to you and wanted to talk about sleep, how would you go from a naturopathic angle?
That's a really interesting question, because if you had asked that before the course, I would have looked at it as any other condition. So I would have said something like, and I still do this, describe your sleep now, describe where you'd like your sleep to be, when did it start, why did it start, if you have this, whatever the issue is, I would treat it kind of like any imbalance and try to find, but so asking all the questions of what makes it better, what makes it worse, what are you already doing, what's work, those kind of questions. And those are good doctor questions, right? I've had a cold. I have a headache. Have you ever had this kind of headache before? Describe your headache. What do you do that makes it better? What do you do that makes it worse? But now I ask more questions about why it's important to them.
Mm-hmm.
So you say you're having trouble with sleep. I want to get the details of what's happening, but why do you think that's happening? Actually, the person I was just talking about has trouble with sleep. She wakes up thinking about connections she's lost or doesn't have, relationships that she used to have. Those are the things that wake her up in the middle of the night.
Oh, wow.
So should I prescribe melatonin, or was it better to talk about how she could reconnect?
Mm-hmm.
It's a whole different thing. It's amazing.
Yeah, that's good.
So, yeah, I mean, sure, melatonin's a possibility, and not, and sleep hygiene, and not, eating or drinking right before bed. All that kind of stuff is important too, and we may discover some things from that. But I can, I know about sleep hygiene and those things, but is that really what's going on here?
Well, can you talk about sleep hygiene? Can you define what sleep hygiene is?
Well, I mean, I define it kind of as a set of rules, I suppose, like to follow. Things like not drinking alcohol 3 hours before you go to sleep. I can explain that. I can say, if someone I would have just gone in and explained it. Now I'll say, do you want to know why drinking alcohol an hour before bed is, could negatively affect your sleep? So I'm kind of learning to say that. It sounds like you'd like to know. But, and I can explain the blood sugar thing and how, our blood sugar goes up, but then it hits this baseline and goes down even further. And if you're hypoglycemic at the time, or your blood sugar is below where it should be when you're sleeping, it's going to wake you up because your body thinks it needs sugar, right? And to wake up. And it's a cortisol sugar thing and all of that. So I would explain that, but that's one of the things. So that's the not eating or the not drinking, the going into a dark space, only using your bed for sleeping and intimacy, and no TV in the room, and no electronics, and all that kind of stuff. And then the piece that I'm learning more for myself is the really preparing yourself to go to bed with a clear mind and a relaxed body and a relaxed mind and relaxed emotionally. No arguments before bed, quiet time, and mindfulness and breathing even. And it's just, we have, and I have the handout, we have a very detailed handout on sleep hygiene that I am happy to give anyone that wants it. But, and it does kind of give a check off for people, like, am I doing this and this and this? And what can I work on? And we can work through it. What's a challenge for you? What's an obstacle? So I don't know that what I would have done on a wellness plan as a naturopathic doctor before is I would have included that. I would have put sleep hygiene, gave the handout. Seriously. That's what I was taught to do.
Yep.
And I mean, I'm not so sure there's anything necessarily wrong with that.
There isn't. That's definitely not, because it's a solution-based approach to it, but not necessarily.
And it's still kind of treating the cause in a way. But we get deeper into the cause now.
Yeah, with functional medicine, you go deeper into asking, well, why are you sleeping?
With the functional medicine health coaching, because functional medicine doctors still only have so much time. And to get to those questions, it is difficult. Because you have, let's say, an hour and a half appointment. For a functional medicine doc seeing somebody in person, that includes half an hour of a physical exam if it's their first meeting. It should be a thorough physical, cranial nerve, neurological, exam. So we had to try to cram all this in. We had half an hour to figure out what was wrong, half an hour to work on a wellness plan, half an hour to do the physical exam, and we'll see you in 30 days. That's a half-hour follow-up.
Well, I interviewed a functional medicine, an IFM certified practitioner, nutritionist, who is here in Florida, and their average take-in is at least 2 hours. And because one thing that's different about our matrix is that it goes back to birth. Like, they want to know basically if you were breastfed or bottle fed, because that can the enzyme.
Well, that's what I'm doing too. As a naturopathic medical consultant, I'm taking a deep dive into their timeline that we're familiar with. And we do that as naturopathic doctors as well. Definitely, that's very important, those early years, and the stress level of your mother at the time that she was pregnant with right, even their mental health, because if they're stressed and anxious, that's producing neurotransmitters and so forth that are getting into the bloodstream of the baby. Right. So these are all things that can kind of start setting up early infections, antibiotic use, all really important to look at by a practitioner. Definitely. Right.
Well, when it comes to, let's say, the pillar of stress, and from a naturopathic approach, what would you do for a client who had high levels of stress?
So what I would have done, and I still will to a degree, is we would have looked at so we would have talked about sources of stress, where it started, again, all of that, to get the background, let them tell the narrative. Very important in all this medicine is to hear the story. But I might have recommended adrenal support after testing, some kind of, and I still do actually, adaptogens like withania, the panics, adaptogens, that family, Stragolus, some of them that are good for immune system too, depending on what the whole picture is. So, so that's like going up the pyramid a little bit further, but essentially to address stress on that base level, it's the same. It's the same as what it's the same as functional medicine. We're trying to get to the root cause, and a lot of that, again, is connection, right? So, I mean, it's basically when we're on that lower level, when we're working that part of the pyramid, when we're working that part of the matrix, I think we all have similar approaches.
Even from a yogic approach, I used to do a stress management workshop, and I used to ask, I had this tree, and then I would say, okay, well, tell me what you do to alleviate stress, and what do you do? Whether it's, go for a bike ride, go for drinking, food, medicine. I mean, all these different things. Now I'd write them as leaves on the tree. And I'd say, okay, well, that's how you try and get rid of your stress, but let's go to the root cause. So you go down the trunk and into the roots to find, why are you so stressed? What is not handling in your life that you would like to handle differently? So in that capacity.
It's all very uncommon. And I'll tell you what, but functional medicine practitioners are MDs and DOs. Yeah. And licensed NDs. You can't become a functional medicine practitioner without that. And so it's because we're not licensed in all states, it's hard to have unity because there's so many different practices of medicine, systems of medicine that are part of naturopathic medicine. I think it makes it harder. Homeopathic medicine is its own system, which a lot of people get confused with naturopathic medicine. And you and I talked about it, would be a whole nother subject, definitely. But it's a modality. There used to be homeopathic medical schools. I mean, it used to be a system of medicine. You were a homeopathic physician. They still are very common as a system of medicine in India and in Europe, where you see a homeopathic physician. And they treat you using homeopathy, which is a very individualized. That's where I learned to say what makes it better, what makes it worse. Because those things, what time of day do you experience this? You know, where, what does it look like? What does it sound like? What does it feel like? And matching a remedy to your very individualized picture. But it still takes on, it's that individual medicine again.
That's really, in my opinion, I mean, I'll just share my own opinion versus, I'm not speaking on behalf of anybody else, but even when it comes time for any kind of medicine, it really should be that personalized, that individualized, because we are all unique. We all have our own thumbprint. And, you know, one person can have, you know, diabetes, and I could have diabetes, but because of my food choices or my lifestyle, I may deal with diabetes differently. I will, because, you know, my genetics, I mean, there's so many predispositions that go with the human body, my mindset, that will make me a different patient than, you know, the person sitting next to me at the doctor's office. And yet that doctor may prescribe the same medication for both of us in the same quantities and the same, which is, there's nothing personalized about that whatsoever. It's like, here's a pill, take it and let me know if it works out. I mean,
and some of these pills work out for 1 out of 6 people, or even up to 1 out of 24. Prilosec is one of those. That doesn't work for everybody. It's like 1 out of 16 people that might work for. And yeah, so individualized medicine is a big part of naturopathic medicine, as we've seen with other. And the one thing that I keep forgetting to mention, which is common among others too, is certainly what we've learned, is preventative medicine. And the difference between treating disease as disease, treating a code, an ICD-9 code or ICD-10, whatever we're up to now, treating that code for insurance, and treating or addressing imbalances, but preventing them. Like for us to, and you know, there's an old Chinese proverb I meant to look up again, but about a good doctor or a poor doctor, a good doctor, and the highest level doctor, the most excellent doctor, doesn't want to see their patient again. They want their patient to be able to heal themselves. And that's a big tenet of naturopathic medicine too, and what we've been talking about.
Yeah, it's also, I think it should also be a tenet of being a coach, you know, to be whether you are a life coach, a health coach, a functional medicine certified health coach, you really should be working to coach yourself out of the job with that client, because to heal. I mean, I was talking to someone, this is years ago, who was a life coach, and she had the same client for like 10 years. And I said, well, I hope that you're peeling away layers of this person's life, because for 10 years, the same person are they still coming back to the same issues? And she said, yeah, they still have. I said, then you're like a therapist. So you're not even a coach, because a coach would be, you know, moving that person in a direction.
Even a therapist. I know people that have worked with a therapist for 30 years. It's time to break away here.
All you wanted was
We're going to take this and not only, we're learning and healing ourselves and empowering that dynamic, innate ability that our body wants to come into balance and wants to heal, we can take that out. There's a lot of people that need this medicine.
Yeah.
Not only can we heal ourselves, but we can heal others as well. We can become.
What is that? Physician, heal thyself. Isn't that
Physician, heal thyself? That's more like I need to heal myself, so I'm going to see you to help me heal myself, so I can take that out. That's
Hippocrates said it. I mean, Hippocrates was the founding father of.
Yes. That's a very important concept. I do not want to minimize that at all. It is very important. We must heal ourselves first.
If they would like to reach out to you and connect with you, how would they find you?
They can go to Cultivate Holistic Wellness, which is with a W.
In the frame down below, I'll put it in there. So go ahead.
Oh, yeah. Okay. So the Cultivate holisticwellness.com is my website. Coach at cultivateholisticwellness.com. I don't usually put my number in there, but I'm on Facebook under Cultivate Holistic Wellness and Dr. Jen B. ND, I think. Something like that. Twitter and Instagram, Dr. Jen B. ND. Yeah, so lots of ways. I answer quickly. I'm very anxious to talk to people. Not anxious, but I love to talk to people and start the journey with them. And I'll always offer some kind of intro session that won't cost anybody anything to just see if it's a fit, if I'm a fit, if we're a fit, and if they think I can help.
Oh, good. Oh, good. And I will mention that with being a nationally board certified coach, whether it's through FMCA, Functional Medicine Coaching Academy, but with the board, they don't accept all coaching schools across the country. So they have a list on their website, which I'll include below as well. So if anyone is looking for a certified coach and who is a board certified, board recognized, there is an exam process. You don't just do 50 hours of coaching and then, get your board certification for your boards. It's a very serious process. So it's not something that's taken lightly. It's just like earlier when we were saying, if you, wherever you are from where you're watching this, is make sure that whomever you are working with is someone who's certified, just because they had a piece of paper from a weekend program, but someone who really has invested their time, their money, their life, it's their passion, because helping people from the inside out, it's a calling. It's not something that is for everybody. And I really believe that people can feel it when they work with you, whether or not you are authentically passionate about helping others. It's there's a that comes with it that is very humbling and very rewarding at the same time.
Agreed, 100%. And I appreciate you doing that. It's very important to those of us that have put that time and effort and a good chunk of ourselves into this.
Oh yeah, it's been a long awaited celebration, that's for sure. So as we wrap up, is there anything that that you wanted to mention before we sign off for the day?
No, I mean, I know I left out some modalities under the naturopathic medicine thing, and maybe we'll have another chance to talk about, some of those. There's a whole thing called constitutional hydrotherapy that's really interesting. Constitutional homeopathy, which, we're treating like the whole constitution of a person, is where they got those names. Hydrotherapy is interesting on its own, but definitely that constitutional hydrotherapy piece. And its history in this country and the world is fascinating, really. So I'd have to prepare a little bit.
I just had the flash of a colon cleanse going through my head.
Not that that's is a form of hydrotherapy. That's not what I'm referring to, but it is what I'm referring to too, because that just ice on a wound is hydrotherapy. Technically speaking, but definitely you will see the word hydrotherapy and what is it? Colon something.
what's the colon is not called. It's a colon hydrotherapy. I see them doing that these days as a colon hydrotherapy because I think the original term doesn't sound very pleasant.
No, and it wasn't pleasant in school either when our colleagues did that to each other, for each other as a service. Now one of the highlights of my career. Let's not end there. Constitutional hydrotherapy.
All right, so what we'll do is we'll plan a follow-up episode and we'll discuss the constitutional hydrotherapy and constitutional homeopathy, and then get into that too.
That would be great. That would be fun.
Well, thank you for your time today. I apologize for the power outages that we dealt with, but it's just you roll with the punches. You got to deal with and it's not even storming outside. That's the crazy thing on the street somewhere. So thank you, Dr. Jen Bitner, for joining me today with the Escape Hatch to Wellness. And for everyone who's listening, please be sure to like, share, and subscribe. And thank you so much, and stay tuned for more.